one of my favorites for kind of everyday wellness is chaga. And chaga mushroom is really, really good for the immune system. It's super high in antioxidants. And I kind of call it sort of the everyday wellness mushroom. So if you're just going to start with one mushroom and you're like, I just want to support my immune system and support my overall wellness, chaga is an amazing one. And you can make teas out of chaga. You can take it in a tincture. There's, companies that sell it in a powder that you can just mix with water. But if you can find fresh chunks of chaga, it's dried. It looks like kind of a cork. You can take that. I find it either at herb shops or you can find it online. You can just put that chunk of chaga into a big pot of water and just let it simmer for a couple of hours, like 2 hours, and then just drink it all day long, especially if you feel like you're coming down with something or you're feeling a little under the weather. I drink chaga tea all the time just to kind of like upkeep my health. And especially when I was writing the book, I wasn't getting a lot of sleep, especially on my deadline times. So I was just, when I don't get a lot of sleep, sometimes my immune system starts to feel weaker. So I was just kind of chugging chaga tea. Like I was just had it on, I should have had like a tap, like a keg of chaga. I was just, really downing it and I never got sick. So I really believe in the powers of chaga for kind of everyday use.
You're listening to the Live Life Longer show with Dan Voss, inspiring you to live longer through the cold, the hot, breathing, eating, and being nature. In this week's episode, my guest is Jenny Sansouci, a certified health coach and wellness expert, and the creator of the popular wellness blog, Healthy Crush. She's a graduate of the Institute for Integrative Nutrition and has been trained by functional medicine doctor Frank Lipman, MD, in New York City. She's also the author of her new book, Rebels Apothecary, a practical guide to the healing magic of cannabis, CBD, and mushrooms. She is based in Brooklyn, New York. Jenny, welcome to the Live Life Longer show.
Thanks so much for having me, and thank you for pronouncing my last name right. That is rare. I appreciate
that. Full disclosure, it was either yesterday or maybe this morning as well. I went back to some of the podcasts that you've been on. I think it was actually, I'm just going to blow the lid off here and share all of my secrets. I think it was Dr. Gundry's podcast that you were on. Uh-huh. And of course I actually listened to it when it first came out, I think back in June.
Oh, awesome.
And then I re-listened to it this past week. But anyhow, it was this morning or yesterday. I made sure I rewound it at the end when you shared where people can find you and you shared your Instagram handle and you pronounced your own last name. So that's when I was like, okay, there it is. Because it's one thing to take how other podcast hosts are pronouncing your name, but when I heard it from your own mouth, I'm like, that's the correct pronunciation. So
all right.
Thanks for acknowledging that. Yeah.
It's been my whole life. People have pronounced it wrong. And when I was younger, I was like, oh, I wish my last name was easier to say. I wish my last name was like Jones or something. But
right.
Now my last name means without worries in French.
Nice.
So now I have a deep appreciation for it now.
Oh, that's super cool. I love that meaning.
Yeah.
That's really cool. So you have your book. I said in the intro, your new book, it's been out for just under a year now, right? I think we can still consider it a new book. I want to get into the contents of the book a little further. Obviously, you wrote it to discover the healing benefits that CBD and cannabis in general and magic mushrooms can have. So maybe we can start off you telling us a little bit more about how you got interested in this topic.
Yeah, sure. Well, I have been, as you read in my bio, I've been kind of in the nutrition and wellness world for many years. I started getting interested in nutrition around probably 2008. And that all stemmed from, I quit drinking in 2007. And so once I quit drinking, I realized that I had to figure out other ways to feel good besides drugs and alcohol. Yeah. So my first go-to, as you know, a lot of people's first foray into the world of, I guess, personal development, a lot of it comes from starting with nutrition. People change their diet, they feel so much better, they start to explore other things. So I started to experiment with my diet a lot, just cutting out sugar, just experimenting with different things. And I started to write about it on a blog. And this is, 2008, there were not very many blogs around, but I worked for a like a big corporate health website, kind of like a WebMD sort of place at the time. So I knew I knew a lot of stuff about websites. So I started a blog. And I started writing about all the things I was learning, like, hey, check out coconut water. Have you guys heard of kombucha? It was just, everything I found I would write about. And eventually I decided to go to the Institute for Integrative Nutrition to become certified as a health coach, mostly because I just wanted to be able to learn about new topics to write about on my blog. I wasn't necessarily even interested in becoming a health coach. I just wanted to learn more. And also just to, have more credibility in my blog and what I was writing about. So I'd been writing for many years, and I had always been interested in the idea of writing a book just because I love writing, but I didn't want to just write any book. People would say, oh, you could write a book about so many different topics that you've learned about in wellness. And I was like, yeah, but I want to write a book when the time comes that, I really need to write this book, and I really need to write it at this time, and it needs to come from me, and it needs to come in this way. And I just knew that I would never write one unless it felt like that. So this book really came to me as a surprise. In 2017, my dad was diagnosed with stage 4 pancreatic cancer. And that was, just really a before and after moment in my life. And I knew that, first of all, it's very shocking to get that kind of diagnosis. For anybody that has had any kind of cancer diagnosis, it's just, you don't really know how to handle it at first. So you start Googling things and you start researching things. And when you Google stage 4 pancreatic cancer, there's no good information. Well, there's hardly any good information.
Sure.
So that was really discouraging for me. Like the first time I Googled it, I was like, okay, I'm not looking this up ever again, because all of the things that you find are, the statistics are not very good with this disease. So I just didn't accept that. I wasn't going to accept that this was going to be like a quick demise for my dad. I knew that there had to be something else that I could do to help him. And with all the, work that I had done with Frank Lipman and all the people that I knew in the nutrition world, I just had a feeling, all right, I can find some things to help him, like with home remedies in addition to his chemotherapy. And so I started researching, I started asking around, I started doing a little digging. And I found a ton of anecdotal stories and, some studies and things that doctors were researching into with cannabis and cancer. And chemotherapy side effects primarily, because there haven't been a ton of studies yet on like actually using it for cancer, but there's a ton of stuff on chemotherapy side effects. And there are some things happening out there study-wise with cancer. But so medicinal mushrooms and cannabis, kept coming up over and over and over for me. So those were the two areas that I focused on. And we just dove in immediately. My dad had watched a documentary about medical marijuana, so he was already open to the idea, and he had seen how it was helping people with cancer and kids with epilepsy, and he was like, okay, I think there's something here. And then medicinal mushrooms, he had no idea about medicinal mushrooms, but I had known about them a little bit, and so I just started to do a ton of research, and there is a lot of research on medicinal mushrooms and cancer, and so I just totally started geeking out and just dove right in.
Yeah.
And as I got him a medical card. We got a medical card at the time in Massachusetts where he lives. Only medical was legal. Recreational wasn't legal yet. So we had to go through the process of getting a medical card. And then we got him on some really high potency cannabis oil. It's often called Rick Simpson oil or RSO, which is just very, very strong cannabis oil with both THC and CBD in it. And he started taking that as well as extra CBD on the side and a bunch of different medicinal mushrooms, and his chemo side effects started to go away. So his nausea, his fatigue, his pain, his loss of appetite. There's so many side effects that can really be, debilitating for people when they're going through chemotherapy. So he started to find relief from some of those things. The neuropathy, the tingling in his fingers and toes started to go away. So we just kept having progress with these things. And his doctors kept saying, your progress is remarkable with the scans and his blood work. He just kept improving and staying stable. And with this disease in particular, staying stable is an amazing thing.
Yeah, absolutely.
So I started to blog about it because I just thought, when I first Googled this, I was so discouraged by what I found. And I want there to be something out on the internet that when people search for this, they find something hopeful. And obviously it's not going to work the same way for everybody, but I wanted people to find some type of relief in what they were finding and say, okay, there's something that I could try that could potentially help, and potentially, you know, not only maybe help with the cancer, but definitely with quality of life during chemo. So that was really important to me. So I started writing about it on my blog, and eventually that got the attention of a book agent, and she said, hey, I think there's something here. I've read what you wrote about cannabis and about medicinal mushrooms. Would you be open to writing a book and combining the two into a book, and not only for cancer, but just for general wellness? Because I had started using all of these things for myself, for just my everyday wellness as well. So I thought, you know, how can I not put this into a book? Because I was getting so many messages on Instagram and in email with people that were reading my blog asking for more specifics or asking for guidance on exactly what we were doing. And I was spending a lot of time writing back to individual messages. And I was like, this is not really sustainable for me to be like all day long. I was getting on the phone with people like while they're at the dispensary and being like, send me a picture of what you see at the dispensary and I'll tell you if it's the same thing we're using, you know? So I was like, oh God.
My God.
There's probably thousands of other people out there that are struggling with these things that I need to just be able to hand them a book, you know?
Yes.
So I feel very relieved now that all of the information that I've come across in my few years of research is all in this book. So that makes it easier to just help people on a bigger scale.
Yeah, I think that's one of the biggest takeaways. Thank you for sharing all of that. I think the fact that, like you said, you went on Google and all you saw was just tons of information that was discouraging. And then you started to find answers through this that brought more hope into your life and to your dad's life. And the big thing, I think, is that, as you know, and what you experience with people that follow you and we're reaching out to you, there are a ton of other people that are in the same shoes as you who want more information or want some answers on how they can do things a little bit differently than what they're being told right now. And that can be anything from cancer diagnosis or mental health concerns around depression or anxiety. So I think what you're doing right now, especially with this book, I will say it's one of the most comprehensive guides that I've written. I don't think there's another book out there like this that has so much information around the topic of cannabis and CBD and medicinal mushrooms on where to go, how to incorporate it into your life safely and efficiently and effectively. So I'm a big fan of it, obviously. I would like to know a little bit more on, I think I read somewhere that, so I guess what I would like to know more about is the process that went into the research of putting this book together. I think I read that you even spent some time on different mushroom farms. Is that correct? Can you maybe share some more stories on like what it really took to put this all together?
Yes, and I'm glad you asked that, because that's what I was thinking when you were saying like, oh, this is so comprehensive, there's so much in it. I was like, it takes a village. It was not all coming from me, obviously. One of the most important things to me when writing this book was that I got a lot of experts to weigh in and to mentor me, and people in the plant medicine world, whether it's mushrooms, cannabis, anything else, they're so passionate about sharing this knowledge with people that they're just they're so generous with helping. I was like blown away by how much help I got. I started to look into, I spent a ton of time on PubMed, reading studies and just trying to find out who are the main players in this field that are really doing the research, and who are the doctors that are already working with patients with cannabis, who are the scientists that are studying medicinal mushrooms, who are like the ones, that I need to learn from. And I ended up reaching out to some of them, and a couple of them became like my mentors through the whole book process, and even fact-checked my whole book, which was incredible. There's a man named Martin Lee who runs a website called Project CBD. It's an incredible resource for not only CBD, but a lot of different health and wellness topics. But he was one of the first people I reached out to, because Project CBD was where I was learning a lot about CBD. And he was like, why don't you come out to San Francisco and I'll give you a tour of a CBD oil facility and you can interview me and I'll show you some places to go around town, like where they're really doing a good, high quality job with cannabis. So I was like, okay. So I went out to San Francisco, got to see, you know, how cannabis oil was made, how CBD oil is made, got to take a tour of the whole factory and interview him. And he's been, you know, in the cannabis industry for many, many years. He wrote a book about, you know, the history. It's called Smoke Signals. It's the entire history of cannabis, basically. So just to have him sort of leading me, because he cares so much about the correct information being out there too. So having him sort of lead me through the process was really, really helpful. There's another Dr. Ethan Russo, who has done a lot of the studies and scientific papers on cannabis, and he fact checked my book too. And I was just blown away by the generosity, because I'm just emailing people being like, hey, I really, really, respect your work. And I think that, if you would be willing to just look over this manuscript and tell me if there's any glaring errors or anything that looks off, it would mean so much to me. And I didn't really even expect to hear back from some of these people, but most of them said yes and took the time to even get on the phone with me and say, okay, page 46 where you said this, that's not exactly what it is. That molecule actually doesn't do exactly that, but it does this instead. So change that. So I'm like going through page by page with people, which was incredible. I went up to Maine to meet with a cannabis doctor named Dr. Dustin Sulak, who he has a website called healer.com. I'm just throwing out tons of resources for people.
Yeah, no, this is awesome.
He's an amazing cannabis doctor and has been working directly with patients because it's been legal in Maine for a while. And I got to sit down and interview him and get some dosing protocols from him. Because one of the things with cannabis and CBD, dosing for me was like the holy grail of information. I was like, I need to be able to share people how they can find, their therapeutic window with CBD. So I went straight to this doctor and he, gave me the whole dosing guide that I have in my book was given to me by him, and what he uses in his practice. So that was really important to me as well. And we went and visited, a CBD farm up in Maine, and I got to see, all like the fields of cannabis. And that was a really beautiful experience. And then on the mushroom side, there's a scientist in Israel that he's the head of the International Journal of Medicinal Mushrooms. His name is Dr. Solomon Wasser. And I emailed him out of the blue too. And I did not expect him to write back because his name was on like every medicinal mushroom study. And I don't know. I was just like, these people to me are like famous,
Sure.
Like,
yeah.
Oh my God, Solomon Wasser. So he wrote me back as well. And I sent him a copy of the book and I sent him the manuscript and he fact checked some of it for me too.
Nice.
And he was like, and I was like, this is amazing. I felt so nerdy. I was like, this is so cool. All these scientists helping me. So that was another, it just kind of put my mind at ease because I really wanted to put accurate information out there.
Yeah.
And then a guy named John Michelotti who owns a mushroom company called Catskill Fungi. He makes amazing mushroom tinctures. And he sort of was my mushroom mentor through the whole book. He also fact-checked it. And I have gone on mushroom walks with him and learned how to make tinctures from him. And he's super, super enthusiastic about medicinal mushrooms. So that was kind of some of the core crew that I tapped into for help. So I could not have done this without all of them.
Hey guys, I want to take a quick second to tell you about Blossom Wellness, a mental health hygiene company that gives people the tools they need to better manage feelings of stress, anxiety, and mental burnout. Their signature product, Bliss Blend, is formulated with lion's mane, reishi mushroom, and full spectrum CBD oil to aid in reducing feelings of stress and anxiety, boosting immunity, and supporting brain health. This is my personal favorite CBD product as it provides a nice blend of calmness along with focus and mental clarity throughout the day. To try Blossom, go to blossomwellness.co and use the code DANVOSS, that's DANVOSS at checkout. Well, I think it would have been very easy for you to write the book in your own way with your own experience and your own opinions and then just call it a day. But the fact that you put the due diligence in to bring in experts and doctors and the right minds around these topics to fact check and to make sure that you're putting out accurate and helpful information.
Yeah.
That I think is the biggest piece there. So good for you to
Yeah,
do
because
that.
one of the things that I saw when I was looking at what books already exist, I mean, there's a lot of wonderful cannabis and mushroom books out there, but a lot of the kind of wellnessy ones were sort of like, yeah, basically just kind of wellness. Here's how to use CBD for wellness. And I just wanted to get a lot of the science and get a lot of the experts involved. And I wanted it to be much more of a, I guess just a deep dive into all the research that's going on, and but make it also really accessible to people, right? Like just a couple sentences about some of the science, and then like here's how to use it. So it was really
100%.
important to me and it made it a lot of work though. Like me doing it this way made it much harder than it needed to be. I don't think my publisher even needed it to be what it is. I think they would have been fine if it was more simple, but I had to be as thorough as possible.
I bet you're happy that you did do it that way, because now you have this book for a lifetime, right? You want to do it the right way the first time. You don't want to have to put it out and then look back and be like, I wish I would have done a little bit more work and due diligence on it.
Totally.
So you did it the right
I could have worked on it forever, but I had a deadline, so I had to turn it in.
And by the way, the way you felt and how some of them responded to your emails is the same way I feel when some of the doctors respond to my outreach emails for my podcast, or even when you came back and said yes. I was like, yes, because
it's so nice. I know.
As I've expressed, I love your book, so it's a great feeling when you get that response back and they say yes.
Yeah.
I guess going off some of that in terms of making sure we're putting out the right information. When we hear the words cannabis or mushrooms, a lot of people tend to think, recreational drugs, and not necessarily medicine. So how do we get past that stigma? And specifically, like from my experience, I grew up in a very traditional, conservative Catholic home that the term cannabis when spoken was like, no, that's bad. That's taboo. We're not going there. But now we're learning so much about the medicine side of it. And I personally am getting more into it and using cannabis and really enjoying it and the many benefits that it has. So what can we be doing to kind of remove that stigma, especially for folks that come from more of that traditional background, maybe more conservative family, where we can maybe open things up and look at it in a different way?
Yeah, I mean, that's a really good point, and it's one of the biggest challenges that I faced even with doing my research and trying to get my hands on certain products. The legality of cannabis, I mean, before cannabis was made illegal, it had been used as a medicine for, thousands of years. Since like the beginning of time, people were using cannabis as a medicine. And it used to be in pharmacies, even in the US, they would use it for pain and headaches and depression and lots of different things. And so when it was the whole kind of reefer madness thing started, where it became a Schedule I drug and became illegal and became, associated with all kinds of negative things. There's a lot of propaganda around it. That just kind of got nailed into people's heads. And what people don't realize about it, which I was really surprised to find out because I didn't know much about it. I thought of cannabis as just like, smoking weed like I did in college. And I thought of it as just kind of this illegal thing that would, just to get high. But when I was starting to do my research, I realized that, in the 90s, a lot of the cannabis, people who were fighting for cannabis to become legal were AIDS patients that couldn't get their hands on the medicine that they needed to feel better. And so when I started to look into the past of, people who were fighting for legalization, a lot of it is patients wanting medicine. I had no idea. I thought it was just people wanting to get high, so I had this, but if you really look into the history, and that book Smoke Signals is actually a really good book to learn about the history. Much of the fight has been advocating for patients, and because there's been so many things that cannabis can help people with, and especially when you have a life-threatening illness and it can take away your pain and your anxiety and help you sleep. It really improves people's quality of life and always has been. It just has a really bad reputation because of all the how it was made illegal and the reefer madness stuff. So it's going to take a while to change it, but I think the more research that comes out and the more people are realizing that it's actually helping so much with people who really need it. And, of course there's people that are just going to use it, just to like relieve their anxiety or to chill out a little bit. And that's all fine. But there's people who are really, really struggling that this makes a huge difference in their quality of life. I mean, I'm getting messages from people who, a lot of people are caregivers like me, whose, parents or loved ones are going through cancer treatment, and they're like, oh my God, my mom had lost so much weight. We were so scared for her. And when she started to use cannabis, specifically with some THC in it, she started eating full meals again. And now she's like back to feeling vibrant, and she has strength again. And she can, when people are on chemotherapy, a lot of times their bodies are breaking down, their immune systems are breaking down, and they can't, if they're not eating enough, then they're just sort of wasting away. It's really terrible. And so when you can eat again, it's a huge deal. So I think the more stories that people can share about how cannabis is really helping in a therapeutic way and changing people's lives for the better, I think the stigma will continue to start to go away. And just realizing that there's so many ways to use cannabis and CBD with no intoxicating effects, I think that's huge. I had no idea when I first started researching, and now I use CBD every single day in a variety of different forms. And I don't get high, but I use it in many different things: edibles, capsules, tinctures, topicals. All different ways, and it really really helps me, and I'm not interested at all in feeling high. So
for sure,
I just think the more stories that get out there, and the more we see people really improving their health, it'll get better and better, I hope.
Yeah, for sure. Yeah, I now am using CBD every single day in tincture form. I have a product that is a really nice blend of CBD, reishi mushroom, and lion's mane. And for me, it is this nice, this real nice blend of feeling a sense of calm throughout my day, but then also really good mental clarity and focus. And I'm not sure if that's from the reishi and the lion's mane. Maybe you can share a little bit more about that blend of CBD, reishi, and lion's mane and what I'm getting from it.
Yeah, I mean, that I would love for you to send me the brand that you take, because that sounds like a great product.
Yeah, they're out of Chicago. They're called Blossom. They're a startup company. Okay. Cool. Yeah, I'd be happy to share information about them. Yeah,
that sounds like a good one. Well, CBD and reishi can both really help with anxiety and calming down the nervous system. So reishi is one that I usually suggest people take, in the later parts of the day, or some people take it at night, maybe in a tea or a tincture, just to kind of help calm down before bed. And CBD is the same way in certain doses. The thing is with CBD, some people with a little bit of a small dose, it can be activating a little bit. And then if you take a little bit more, it can be calming. So you really have to play around with your dosage. But for me, CBD really helps with anxiety, and so does reishi. So that makes sense to put those two together. And then the lion's mane is really good for mental clarity, memory, focus, cognitive function. Yeah, so adding the lion's mane, I mean, I'll take lion's mane sometimes in a tea before I sit down to write or sit down to work, and it really helps me. I was drinking lion's mane tea the whole time writing my book, because it just really helps me kind of drop into the zone. So that makes sense that you would feel calm and focused. I like that. Okay.
That's what I thought. I thought the lion's mane was more of the mental clarity and focus, and the others were more of the calming effect. So yeah, that's cool. So with your experience, I mean, you're experiencing firsthand with your story of your dad going through chemotherapy. What other ways, or I guess, how can we look at cannabis and mushrooms to not be an opposition of conventional healthcare, but rather supplement conventional healthcare?
Well, that's the first part of it is, I think, for any patients that are going to be using conventional medicine for whatever they're struggling with, is to do your own research and figure out what exactly are you interested in taking as a home remedy, in addition to your conventional treatments. And one of the things to do would be to make sure there's no drug interactions that could happen with any, prescriptions that you're taking. And Memorial Sloan Kettering Cancer Center website actually has an amazing database with all different alternative remedies, herbs, and supplements, and you can search for them, and then it'll give you a list of potential drug interactions. So I think that's, one place to start if you're just is this okay for me to take? And then bringing it up to your doctor. Of course, every condition is different. Sometimes you need to bring it up to your doctor because it's very serious. Sometimes it's something, more general that you can just manage on your own. But we brought it up to my dad's oncologist, and this is where I do see people running into some challenges, because a lot of doctors don't know enough about cannabis and medicinal mushrooms to be able to give a recommendation, or they just actually aren't allowed to give that kind of recommendation due to their, the protocols at their hospital or their training. They just can't say, yes, you should do this. So a lot of doctors will say no because they just want people to be conservative. So I always tell people that if your doctor says no to using any of these things, ask why, and ask if there's a specific reason that's connected to you and your personal condition on why you can't take this. Or ask them, do you just not know enough about this, which of course is fine, but is this just, you just don't have enough information, or is there actually a risk that you know of? And if there is, can you send me or direct me to some of that research so I can look into it? Because a lot of people will just hear the no from their doctor and they won't ask why. And they'll say, oh, I'm not allowed to take this. And so I'm always like, just push a little bit further. Maybe the doctor's correct. Maybe you shouldn't be taking it. Maybe there's a medication that it'll interact with, but maybe not. And I would say just keep asking questions until you understand. I think that's the most important part. My dad's oncologist said, listen, I can't tell you that any of these things are going to help. I can tell you that they probably won't hurt. So do what you want, and let's just keep checking in, at each appointment, at each scan. If things are getting worse or something is going wrong, we'll stop them. And that hasn't happened. So I think, just making sure you kind of have like your whole team kind of on board and everybody understanding, why you're doing what you're doing.
I think that's so important to ask your doctor why. If they tell you no on something, or even if they give you any kind of information, is to dig deeper on why. And to your point, I think a lot of people will just kind of accept what the doctor says. And sometimes there's a reason and they're right, but I think it is important to go a little bit further and ask why.
Because some of these plants, they've been used, like I said, for thousands of years, and there's a high amount of deaths every year just from, pharmaceutical drugs being misprescribed or, medical accidents. And, it's just not like the conventional medicine is like totally foolproof. There's things that can happen with any kind of treatment. So I just think it's important to do some research, to look into it, and to check in with yourself about what feels right for you. Because one of the things is, belief is a huge part of healing. And if you believe in your treatment, that's going to go a long way.
For sure. I'd like to spend a few minutes around the topic of cannabis and the benefits of cannabis. We've talked about CBD and how it can have, benefits of calming effects, reducing anxiety and stress. So maybe we can just talk generally about cannabis and the benefits that it has. For me, I feel like since I've started taking or using cannabis, I am I'm a kinder person. I'm more patient. I am more loving. I just feel happier, honestly. And it's been a few years. I would say it's almost 2 years now that I've been using cannabis. So maybe we can talk about some of those benefits and any other benefits that you're seeing either personally or other people you talk to.
Yeah. First of all, that's beautiful that it's had such a positive impact on your life. I hear a lot of stories of people saying the same. Well, when it comes to cannabis, I think something that's important to know is there's hundreds of different compounds inside the plant. So some people get confused, like what's hemp versus marijuana versus cannabis. There's like all these different terms. Cannabis is just the overarching name for this species of plant. And there's, like I said, hundreds of compounds within it. So some, strains of cannabis can have really high THC levels, which is the compound that makes you feel high. Some can have very high CBD levels, which does not make you feel high, but still has a bunch of therapeutic benefits. And then there's a bunch of different ones that are in between, so you could have like a 50-50 split, or, there's all different kinds. So I think that's important to understand. There's all different ratios, and for every person, a different ratio is going to work better, and in different methods of delivery as well. So like you may, for instance, I guess I'll start with saying that one of the things that people use both CBD and THC for is pain. Whether it's joint pain or muscle pain or whatever kind of pain, arthritis, people use, capsules or tinctures or topicals, depending on what kind of pain it is. And you can use, with topicals, you can use something with a higher THC level and not feel the intoxicating effects as you would when you're, inhaling or taking a tincture. So, some of it can, of course, get into your bloodstream, so you might feel a little bit of something, but I use high THC topicals for all kinds of different pain, or like muscle pain, or menstrual cramps and back pain. I have, I broke my tailbone a few years ago, so when I sit for too long, it can get like really achy. So I have a high THC topical. You have to get that at a dispensary. That really works wonders on that kind of pain. So you can use, like I said, different ratios. And sleep is another big one that people use it for. Some people, I use a CBD tincture for sleep every single night. It just helps to kind of like calm my mind and calm like any body anxiety that I have that's like kind of keeping me on edge. The CBD will calm that so I can fall asleep. Some people like to take higher levels of THC for sleep. I personally don't, because if I start to feel the THC, that is more activating for me. But for some people, it really puts them to sleep. So you really have to experiment. So anything that's like so if you see a ratio on a cannabis product, like 20-1 CBD to THC, that means for every 20 milligrams of CBD, there's 1 milligram of THC. So that would be like a high CBD product. Or you could have like the opposite, where it's really high THC, really low CBD. So I think if you're new to cannabis, I would start with something that's much higher in CBD than THC, and just kind of experiment with that. And if you find the relief that you're looking for, whether it's anxiety, pain, sleep, then you can stay at that ratio, stay at that dose. If you feel like you need more relief and you want to kind of up the level of THC, some people feel better at like a 10-1 ratio of CBD to THC, or an 8-1 or a 4-1. And some people will my dad takes a 1-1 ratio. So it's 50-50 because he gets the most relief from having that amount of THC, where you will feel a high. Some people are more comfortable with that than others. But when it comes to pain and sleep and nausea and all of those things, different levels of THC can make a difference.
Yeah, no, that's super helpful. For me, I like CBD before bed as well to help fall asleep. And some of the other things you mentioned there as well, definitely I resonate with. Are there, for some people, can they have a different reaction or experience different effects from cannabis? I've mentioned how life-changing it's been and how I feel like it's made me a better person. But I also know some people that have experienced more of like paranoia when they have cannabis. Can you maybe kind of touch on that further, on the difference between, how one person can have a great experience and the other person can have not so great of an experience? Yes,
I will say that the paranoia thing typically comes from higher levels of THC. So if you're experiencing paranoia from cannabis, you may want to bump up your levels of CBD higher and bump down the THC. And that's pretty common. But one of the reasons that it affects people so differently is because we all have this system in our body called the endocannabinoid system. And it works with the molecules in the cannabis plant. So we have receptors that these molecules in the cannabis plant will bind to and interact with that can cause different reactions within the body. And the system is designed to keep us in homeostasis or balance. So, it will naturally fluctuate our levels of cannabinoids, which we have in our body already. They're called endocannabinoids, and the ones inside the cannabis plant are phytocannabinoids, but they all work with the same system. And all of us have a different system. So we have different levels of these endocannabinoid molecules, circulating through our body. You and I will have totally different levels, depending on a lot of things, lifestyle, genetics, all of that. And also just the quality of the receptors and the amount of receptors. We all have different amounts. So that's something that they're currently studying, right? It's called the endocannabinoid tone. And they are working on, being able to test that better for people so we can really be more targeted with our cannabis therapeutics. But it's kind of like, I always compare it to, your digestive system. Like what food works for you may be different than what food works for me. We all have a different state of our microbiome and our digestive system. So it's kind of like that. So that's why some people will interact differently. So that's why you have to do a lot of experimentation to find, what dose and product works for you.
Yeah, that's super helpful. I think that is a big thing there is finding that right dose for you.
Mm-hmm.
And some people, they might have one experience and it might be the wrong dose for them, and then they just give up on it and give up on the idea. So that's encouraging and really helpful. Going back to the idea of mushrooms, we were talking about reishi and lion's mane. What other medicinal mushrooms do you like, and what purposes do they serve?
Well, one of my favorites, I have a different favorite all the time, but one of my favorites for kind of everyday wellness is chaga. And chaga mushroom is really, really good for the immune system. It's super high in antioxidants, and I kind of call it sort of the everyday wellness mushroom. So if you're just going to start with one mushroom and you're like, I just want to support my immune system and support my overall wellness, chaga is an amazing one. And you can make teas out of chaga. You can take it in a tincture. There's, companies that sell it in a powder that you can just mix with water. But if you can find fresh chunks of chaga, it's dried. It looks like kind of a cork. You can take that. I find it either at herb shops or you can find it online. You can just put that chunk of chaga into a big pot of water and just let it simmer for a couple of hours, like 2 hours, and then just drink it all day long, especially if you feel like you're coming down with something or you're feeling a little under the weather. I drink chaga tea all the time just to kind of like upkeep my health. And especially when I was writing the book, I wasn't getting a lot of sleep, especially on my deadline times. So I was just, when I don't get a lot of sleep, sometimes my immune system starts to feel weaker. So I was just kind of chugging chaga tea. Like I was just had it on, I should have had like a tap, like a keg of chaga. I was just, really downing it, and I never got sick. So I really believe in the powers of chaga for kind of everyday use.
Yeah. Yeah. And that's something that people are so focused on right now within the last year is boosting their immune system. So that's really good. Yeah.
Another one of my favorites, which they actually use a supplement in China and Japan alongside, in the cancer hospitals alongside chemotherapy, they use a supplement called AHCC, and it's derived from shiitake mushrooms. And shiitake mushrooms are amazing for the immune system as well. They've also shown to be antiviral. The easiest way to get more shiitakes into your life is just to eat more of them. I mean, it's not the most concentrated way to get the medicine to eat them, but I'm making shiitakes like a few times a week, and pretty much every day lately I've been just eating shiitake mushrooms because it's just like a really good way. If you're gonna, be cooking up vegetables anyway, throw some shiitakes in there because it's just an awesome way to eat your medicine. That's a really easy one for people, just because you can find shiitakes at almost every grocery store. So cool. That's a great one. And then cordyceps is one that I really love, and that's really good for energy and stamina. And a lot of athletes will take cordyceps before working out or before sports. So that can really kind of give you a steady boost of energy without being caffeinated. So if you're not really a caffeine person, or you need a boost like later in the afternoon, 3 or 4 o'clock, making a cordyceps tea can be really amazing. Yeah.
There was a phrase you said that stuck out, was to eat your medicine. And I just love that idea of food as medicine. Yeah. And like you said, if you're cooking vegetables, you might as well throw in some shiitake mushrooms. So I love that phrase, was, eat your medicine. And something I think need to get back to, especially in the US, we've gotten to a point where it seems like we just medicate every issue and put Band-Aids over every single issue. Yeah. And we're losing sight of the idea, which has been around for centuries, is that food is medicine and should be medicine. So thank you for bringing light to that.
Yeah, if you want to eat more medicine, maitake mushrooms are another one of my favorite. They're sometimes a little harder to find, but they're also really good for the immune system, and they can help to regulate your blood sugar as well. So maitakes are an amazing one. And then your lion's mane that you're taking in a tincture, you can also cook that if you find it at the farmer's market, or sometimes you can find it at the grocery store and just kind of saute it up. It's delicious. So maitake, shiitake, and lion's mane, those are the kind of big three for cooking.
That's great. I never even considered lion's mane to incorporate into my cooking. I'm definitely gonna start doing that.
It looks funny because it's kind of furry. That's why it's called lion's mane. It actually looks like a lion's mane, but you just chop it up and I'll put it in a pan with grass-fed butter, and Yeah, it's really, really
And
good.
you said that's more common to find when you do find it, you're more likely to find it at something like farmer's market?
Yeah, I mean, I see it at Whole Foods in
Okay.
Brooklyn, but it's not, I don't typically see it at regular grocery stores. So maybe if you have like a gourmet grocery store that has a big mushroom section, you might be able to find it there. Otherwise, if you have a local mushroom grower, you may find it at your farmer's market.
Cool.
You can also grow your own pretty easily. There's a company that I really like called North Spore, and I've ordered some lion's mane kits from them, and they're pretty easy. But if you really want
Nice.
to grow it at home, you can try it at home.
That's great to know.
Yeah.
While we're on the topic of mushrooms, I feel like when I have conversations with people and I mention the word mushrooms, they automatically think I'm talking about psychedelic mushrooms. So maybe we can transition to talking about psychedelic mushrooms a bit and how, for us, it's probably obvious how medicinal mushrooms are different than psychedelic mushrooms. But maybe you can talk a little bit about that idea of what's the difference between the two
Yeah.
and why someone would look at taking, psychedelic mushrooms for medicinal purposes.
Yeah. Well, that's a good point, because one of the reasons that I put mushrooms and cannabis in the same book is because I kept getting the same questions about both of them. Like with CBD, it's like, well, am I going to get high? And with
Right.
medicinal mushrooms, it's like, well, am I going to hallucinate if I take these? So I
Right.
really had to do a lot of explaining about that. So there still is, not a ton of, people like the thought process goes right to psychedelic mushrooms because that's what people
Right.
think of. So I guess I should just say that all of the mushrooms we've talked about so far are totally non-psychedelic. So all of them are, more food type of mushrooms, food and medicine type of mushrooms. But there are, the psychedelic mushrooms that people often think of as magic mushrooms, the compound in them is called psilocybin. I mean, there's many different psychedelic mushrooms, but the most prevalent one that people are talking about and they're doing the research on is psilocybin mushrooms. And those are still currently illegal, but the laws are changing, just like they are with cannabis. So they're becoming decriminalized. Although I think it's going to look different with psilocybin mushrooms than cannabis. I think in the coming years, we're going to start to see psilocybin available in therapy and in therapeutic settings. I don't know that it will, like with cannabis, it's just becoming like you can go buy it at a store or
Right.
dispensary. Right now they're studying psilocybin mushrooms for treatment-resistant depression, which is really, really interesting to me. And, kind of comparing how it works compared to traditional SSRI antidepressants, and people are, they're having really, really good results with it. They're just doing a ton of good work, and they have been for years now. And these studies are starting to come out, and I think it's really going to change the mental health field in the sense that, it's interesting because with psilocybin, when you take an antidepressant, you have to take it every single day. So obviously the pharmaceutical companies would rather have you be taking something every day. But with psilocybin, you only need to take it a couple of times and maybe, revisit it a couple of times a year and have these therapeutic sessions with psilocybin where you're working directly with a therapist. They administer a high dose of psilocybin. This is what's happening in the clinical trials. And people often have a really healing and often mystical experience. And they can, they end up sometimes working through their traumas or seeing their life in new ways. And it's rewiring your brain and repairing your brain. And people come out of these things with their depression being lifted for months.
Yeah.
And so that's why it's really, really promising, because if you have struggled with depression and you've tried different antidepressants and it's still not working, a lot of people, antidepressants just don't work. So I think it's really, really cool and promising because people will be able to have these therapeutic sessions. I think there'll be probably retreat centers and things like that will open up for therapeutic settings for psilocybin, and people can be able to be possibly relieved of their depression that they've been struggling with their whole lives. So it's really, really interesting.
Yeah, it's fascinating to me. I'm by no means an expert on the topic. I'm learning, and that's what I'm mostly doing right now, is just learning about it and reading, and the research that's going into it right now, I think, is really promising. I agree with you that I think it will be different than cannabis, where right now, like you said, we can, in a lot of states in the U.S., you can go to a dispensary and buy it legally, where psychedelic mushrooms or any kind of psychedelics, it's going to be probably more in a therapy setting. I was just watching the Goop Lab on Netflix with Gwyneth Paltrow, and one of the episodes, it's a Netflix series. One of the episodes, some of her team, I forgot where they went. It might have been Jamaica, or it was somewhere where it's legal. And they went to a retreat, and it was in a therapy setting. It was with trained professionals, and a lot of the folks that were on that retreat were sharing their experience. And one woman said that she felt like she had like 4 years of therapy all packaged into like 1 or 2 days, which was remarkable. It just shows that the experience a lot of people have, it's like bringing whatever trauma or issues they might have deep within them, it's bringing it to the surface and allowing them to address it and meet it and greet it and then work through it and then move on from it, rather than just letting it bury and be festered inside for years for a lot of people. So I think there's a lot that's happening there that is promising on that therapy side and on that mental health side.
Yeah, totally. And, people will continue to just experiment with these mushrooms on their own. And I think if people are doing that and have access to it, I think one of the most important things to remember is that in these settings, there's a lot of preparation, there's a lot of support, and there's a lot of integration work. So, anyone that is considering trying it, I would say if you can work with someone that's really trained or has a lot of experience in it that can support you beginning, during the session, and after, I think that's super important. And at the very least, have like a someone very close to you that has experimented or, has enough experience with psychedelics to be able to hold space for you, and just know that you'll probably need some support afterwards to just really integrate what you've learned and, speak to a therapist afterwards to work through some of it. And just having the right kind of support system is really important with psychedelics, because they can take you to places that you're not expecting to go. And
right.
So, it's not to just kind of be like, let's just see what happens. I think, I took mushrooms in college and it was kind of just like a recreational experience, and there's a place for that too, of course. But I think with these, with healing and focusing on mental health, it's important to have support.
Yeah, 100%. That's a really good way of putting it. Well, good. I have one more question for you before we get to that, Jenny. Where can people find you, find your book, and learn more about your work?
Well, people can find my book pretty much anywhere that books are sold. If you go to rebelsapothecary.com, that's where there's a whole list of retailers there, but it's on Amazon and everywhere. But if you go to rebelsapothecary.com, you can get a few little free downloads that I created, like a dosing guide and a couple of other things. There's a webinar that I did with my dad that you'll get. I'll send it to you if you can buy the book through that site. So that's pretty fun. If you go to my blog, which is healthycrush.com, you can download a free chapter of the book. The immunity chapter I put up for free. Last year when there was so much focus on the immune system, I was like, why don't I give away my immune system chapter for free, just so people can start to see how specifically medicinal mushrooms can support the immune system. So that's there at healthycrush.com, right at the top of the page. And aside from that, you can find me on Instagram, Jenny Sansouci, Jenny, Jenny Sansouci.
Love it. Yeah. For the next person that interviews you, maybe they'll look back at this podcast and
and listen to my name.
Replay how you pronounced your own name.
Yeah.
One person at a time will learn how to pronounce Sansouci. Very good. So also, I just want to give one more plug on the book. Anyone that is interested in the topic of cannabis, CBD, mushrooms, this is the book. Honestly, it's got so much information, chock full information on the topic, practical tips, and like I said, it's truly a guide for anyone that's either using cannabis or mushrooms on their own and want to learn more about it. This is the book. So also, I haven't told you this yet, but I'm just singing your praises today. I also love the branding that you have.
Thank you
for the book. Just I love the colors and the typeface you use.
Oh, thank you so much
very,
for saying
very
that.
Unique.
It took a long time to get it all right. That's part of the book process that I never really anticipated, is like the design of the book and figuring out where things are going to go. And I moved the different like elements on the cover so so many times and change the color of things. And it's a whole process. So thank you for
I
saying that.
have, in my past life, I spent a few years in graphic design. So I guess it stood out to me right away. But I totally get what you're saying. You're working on a project and it can sometimes take hours, well, depending on what it is. Like the cover of your book, I'm sure it took several different trial and error, but just on one single like logo or one piece of design, it can take hours. You're moving things and it's a lot of work. So I appreciate it.
Yeah, thank you.
Yeah, of course. My last question I have for you is kind of around the why of doing all of this. Who do you want to impact the most with the work that you do?
That's a great question. Well, when I was writing the book, there was kind of two kinds of people that I had in mind. One was, of course, caregivers who are supporting someone else through their health journey and who know, like I knew my dad wasn't going to sit around doing all of this research and figure out a home plan for him, but I knew that I had it in me to do that. So people like that who are like, you know what, I have a loved one who's suffering and I want to open their mind to new possibilities for healing. I think I would love to, support those people. And then the other kind of group is maybe you're not a caregiver for someone else, but you're just really wanting to feel more vibrant and alive and healthy in your own life. And plants can give us so many benefits. And I think, not only cannabis and mushrooms, but all different herbs and all different plant medicines. There's so much available on this earth naturally that can heal us and help us. So just if you're feeling like there's got to be more and you're interested in, the ways that plants can help support you, then hopefully I can help to further along that mission.
I love it. Yeah, the piece I have in my intro is, I talk about what the podcast is about, and the last piece is being nature. So when you're talking about herbs and what's readily available to us in plants, it really hits home for me, is that we can use what's given to us in a natural way. Yeah. And you're doing that. You're shining light on that topic and educating people and giving them really great resources. So Jenny, thank you so much for coming on and for giving your time.
Thanks so much for having me.
Absolutely. My pleasure.